Hi, everyone. We're really excited to share with you our leadership project, Giving Voice to Values and Adaptation for the Global Health Workforce. My name is Nikita Boston Fisher, and I currently serve as the Associate Director of the Laidley Center for Business Ethics and Equity in the Desautels Faculty of Management at McGill University. Prior to my current role, I've had the opportunity to work in a variety of different health settings in 3 different countries. Bhakti?
Hi, I am an associate professor in emergency medicine, infectious diseases, and international health. I also serve as the associate director of academic programs at the Hopkins Center for Global Health, and I'm the director of the Center for Global Emergency Care. I was, until recently, the Global Health Security Technical Director for a $660 million project that was focused on global health security strengthening across 25 countries. We're excited to share with you Giving Voice to Values.
So, what is giving voice to values? GVV is an innovative approach to values-driven leadership development in business education and the workplace. It was developed by a leading management scholar, Mary Gentile. It isn't about persuading people that ethics matter or that they need to be more ethical. It starts from the premise that most people already want to act on their values, but that they want to feel they have a reasonable chance of doing so effectively and successfully. It therefore focuses on implementation, not about analyzing what is the right thing to do, but how to get it done effectively. What if I were going to act on my values? What would I say and do? How could I be more effective? That's what it asks. So in GVV cases, the protagonist already knows what they believe the right thing to do. And so now they focus on questions like, who do I talk to? What would I say and do? How can I be effective? In what order? What is the likely pushback I will receive? What data do I need to gather to combat that? GVV is really about scripting and action planning, constructing responses to the reasons and rationalizations that might keep people from acting on their values and practicing those responses. We thought that this could be useful to try in the global health setting because many challenges faced in the world of health today are not medical, they're management related. The interventions and treatments exist, the know how is there. The challenge often seems to be around issues of equity, red tape, and management or mismanagement of resources. And since this curriculum has been piloted in a variety of settings and countries around the world, why not pilot it for this use case? We decided that we would develop some cases, share them with Mary, the author of the curriculum, and ensure that we were maintaining the spirit of giving voice to values in our adaptation. Bhakti will tell you more about the cases now.
So in total, we developed 5 cases, and each of these 5 cases is reflective of our own lived experience. The first case was sharing at what cost. In this case, a junior researcher is asked to share data quickly to a collaborator in the US, bypassing often lengthy and painful regulatory safeguards such as the IRB. In the second case, we talk about the power in priorities. A regional health official insists that medication be directed to a venue or a district where the burden of disease is low, opposed to following the epidemiological data and targeting the medications to a high needs area. In a favor for the few, a consultant is preparing a global fund proposal and is asked to include a vendor or a subcontractor that has questionable qualifications for the scope of work that's proposed. This is WomenLift Health, so there had to be a case about the presence of women at the table. And so in the missing women, a medium level program officer is at an international NGO meeting and is asked to hold back their feelings on the lack of representation across the table for a proposal that is focused on gender inequity. And given that AI is now in all aspects of our lives, the last case talks about an AI algorithm. The data scientists realized that the AI algorithm was trained on an urban venue and that in rural contexts, it may inaccurately predict outbreaks, which is problematic for scale up. In each of the cases, the question is what is the right thing to do? What is the ethical quandary? That is actually very clear. The question is how to navigate these difficult conversations and situations so that you can live your values.
So, what's next? We plan to continue working with Mary to refine our adaptation. We will be hosting a pre-conference workshop at the CUGH conference on April 9th of this year from 1 to 4 p.m. And the UJMT Fogarty Fellowship Consortium and the JHU Center for Global Health have kindly agreed to cover the cost associated with hosting our workshop. So we'll be piloting this live and we'll be able to get additional feedback at the workshop and adjust accordingly to ensure that we are hitting the needs of the global health workforce with this workshop. And once it's all done, we hope to make this course available to our institutions, the Fogarty Fellows, and future WomenLift Health cohorts.
I wanted to end with reflection. I really came to Nikita to ask to be a part of this project that she had already identified. And the reason was the start of the WomenLift journey, there was a lot of turmoil. There still is in global health. And I wanted to pause and reflect on how I may have contributed to the stories, the misrepresentation of global health that has been happening in the public media and in our politics. And had I had spoken up, had I had lived my values better, could I have altered? Could I have changed the course of the activities that I was advising on? And the answer is yes. I maybe just didn't have the correct tools or skills to do so. And so this course really comes from a place of trying to have impact, recognizing that the field of global health is evolving. And it's evolving rapidly, and our landscape is changing. And that new leaders, emerging leaders, will rise, but we need to make sure that they have the right skills to be able to navigate some of the complexities that many individuals will face as they're trying to have impact in this world. We're super grateful to have the opportunity to work together and to learn on this journey together. And we're excited to share giving voice to values to a broader audience. Thank you.
Thank you.